This is an article that came out in the Hartford Courant. DPH reports 3,090 suspected overdose deaths in Connecticut hospitals just this year. I mean, we're only in May. This is really outrageous. Okay, and this is what they reported as of April. And we're already partway through May, so you can imagine it had to go up, even from that number. About 3,090 suspected overdoses have been treated in hospital emergency rooms across Connecticut so far this year, the State Department of Public Health reported. This latest release of statistics comes weeks after DPH announced it had started to collect data on emergency room visits for overdoses for the first time in an effort to make better spot patterns and respond with the right resources. Previously, this information was not collected and public data was limited to drug deaths tracked by the State Medical Examiner's Office. While the currently available data are preliminary and should be interpreted with caution, we are working to improve syndromic surveillance capabilities to provide real-time information to better understand the types of opioids, including fentanyl and associated substances, in combination with other emerging drugs causing or contributing to unintentional overdoses and deaths, said Dr. Raul Pino, the head of DPH. Given that the system had just launched, comparisons to past years are not possible. The system tracks all overdoses, including drugs and alcohol, treated in emergency rooms. The statistics include fatal and non-fatal overdoses. Officials said preliminary data shows that statewide emergency rooms saw an average of 180 suspected overdose cases per week in January through April. The data broken down by county also showed that Hartford County saw the most cases suspected overdoses at 1,021, followed by New Haven County, which had about 900. The data, DPH said, is collected through the state's syndromic surveillance system known as Epicenter. Using money from a federal grant, DPH bolstered the system to add suspected overdoses and syndromes as syndromes reported to the Epicenter. The real-time nature of the data will allow us to respond more quickly to changes in patterns of non-fatal and fatal opioid overdoses, and to design, target, implement, and monitor more effective interventions to break the cycle of overdose and death and curtail opioid addiction in Connecticut, Pino said. And Connecticut has been one of those states that was hit very hard by this opioid plague and drug deaths. DPH said the data provides a more accurate picture. The collection of overdose data is a work in progress, and we will continue to collaborate with the hospitals to ensure that the data we are collecting provides enough detail to understand why individuals are seeking care in our emergency departments, Pino said. This is one of the latest efforts undertaken by the state to better share information about the opioid epidemic, which has not slowed its lethal toll through Connecticut. Earlier this year, the Office of the Chief Medical Examiner, one of the first departments to publicly release statistics, reported that 1,038 people died of drug overdoses, an increase over past years that was fueled largely by the prevalence of powerful synthetic opioids, fentanyl, which we know is coming from China. Okay. And it's still flooding into the country, this country from China. It has not let up one bit. They have tried to put so many things in place. The problem is China is sending the bulk in, but there's a lot of fentanyl coming over the borders of Canada and Mexico as well, and from the islands. So it is, the US is literally being hit from every single border with these drugs. And you really can't complain heavily about these drugs coming in, because they wouldn't come in if the demand wasn't there. People in this country are demanding the drugs. That's why they continue to pour in the way that they do, and it's taking people out. People are being wiped out by these drugs. And the numbers go up every single year from the CDC, which is an undercount, by the way. Remember, they only count 22 states, not the entire country. So you could probably double or even triple the number that they're giving us. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell. And if you have an Android device, please go out and get my app. You'll see the link in the comment section, along with other links. If you are interested in making a donation to my channel, it would be deeply appreciated. I want to continue to get this work out to you. Some of the work I do, especially the presentations, can be time consuming. So any help you can offer is deeply appreciated. And I will see you on the next video. Peace, family.